Are elderly cancer patients being denied treatment simply because of their age? A leading charity says they are, and that thousands of lives could be saved every year if the NHS focused on the health of individual patients. A new study suggests that far too many elderly patients are just written off as too old to treat. Our health correspondent Dominic Hughes reports.
The older we get, the more likely we are to develop cancer. But older patients are less likely to get access to treatments such as surgery, radiotherapy and chemotherapy. The accusation is that in some cases, people miss out because of age discrimination. 81-year-old Les Scaife was diagnosed with cancer, but felt the doctor seeing him was more concerned about his age than his illness.
I felt quite angry that my age should be an issue, and it seemed to me that the age was coming before the diagnosis of the problem. And the thought ran through my mind, perhaps I wasn't going to get the treatment because of my age.
So how do you ensure that doctors and other medical staff treat patients according to their fitness, not just their age? Well, here at the ClatterbridgeCancer1 in Merseyside, they've been working on a project to try and ensure older patients get the treatment they need.
So we've scanned this chap today, he's had some oral contrast.
Okay. The idea is pretty simple, a detailed assessment of the patient's fitness and assistance at home to help them cope with the sometimes demanding treatment, judging each case on its own merits.
Maybe 20 years ago, a 70-year-old patient might have had some other medical conditions that meant that they weren't able to tolerate treatment. However, nowadays, 70-year-olds are much fitter and are able to tolerate treatment. It should be based on how fit they are rather than their age.
And leaders within the NHS recognise that this is a problem that needs to be addressed.
I think there is a measure of ageism within the NHS. I do not think that is intentional ageism, but unintentional, and that means that patients are being treated on the basis of their age, not on the basis of their fitness for treatment.
Cancer survival rates in the UK are improving, but there is still a significant difference between those diagnosed when they're relatively young and the elderly. Experts say a growing number of older people are now well enough to be diagnosed with cancer and still survive. Dominic Hughes, BBC News, Merseyside.
A second arrest has been made by